Welcome back to another episode of Pretend I Don't Know Anything. I'm Mike Jones, here again with Grant Young. Grant, in our last episode, we were talking about what I call the chicken or the egg, but we started kind of diving into this rabbit hole a little bit about the medication and the substance use. There was something you said in the last episode. You said when you were getting sober 12 years ago, back then you were kind of the odd man out in the med line at treatment. And nowadays, you'd be the odd man out if you weren't in the med line, right? And how that pendulum was kind of swung, which it tends to do, from substance use primary treatment, which was, and I can understand where people get confused, where if it's substance use primary, it means that they're not doing a secondary. Maybe because 10 years ago, substance use primary was substance use. Yeah. And that's what they were looking at. Where now we are, much more in tune and aware of the other issues that are involved in treating those at the same time. But I do feel, and I see pretty often today, that maybe that pendulum is swinging a little too far over, where we are seeing individuals now that are on so many different medications and a lot of medications that do the exact same thing. They're redundant medications, and that being a little bit of a problem there. I'm by no means, so I want to give the impression, do not take your mental health seriously, and it is serious, and by no means do I want people to think I shouldn't follow the recommendations of my doctor when it comes to this. You should. It is okay to get second opinions in this stuff as well. And sometimes those medications are absolutely needed and sometimes they're not. Sometimes they're needed in the beginning and for a transition, but as we continue to work and we can get into therapy and we can build a healthier lifestyle and feel better about ourselves in general, we're rebuilding some self-esteem and things are coming together. Some of those medications can be peeled back, and we can live healthier. But you recently you just said something too about, individuals getting on medication and still using substances. Yeah. And the adverse effects in that. So can you elaborate on that a little bit?
Yeah. I mean, you and I were talking to an individual just as yesterday. I don't think these meds are working.
Yeah.
And if I could just be totally blunt, it's like, dude, you haven't stayed sober a day in the last year and a half. Yeah. So myself, the best psychiatrist in the country, isn't going to be able to tell you if that medication's working or not. You haven't given yourself a real chance for that medication to actually work because you're continuing to get high and get drunk. Yeah. I mean, the reality is that we have to take a break from these things to figure out what our baseline is. We have to, that's what I was talking about in the previous episode, which is let's get sober. Let's start living healthy and then figure out what we need to do, And we're going to need some medications, most likely, me included, at the beginning just to get to baseline so that I can make it through that week or that 2 weeks or that first month or the first 6 months of sobriety.
Yeah.
I took medications for the first, it was around 2.5 years to 3 years of my sobriety. I'm 12.5 years sober now. I've been off of those medications, obviously psychiatrist approved, sponsor approved, but I needed that. I needed that to get me going, to keep me throughout the day without feeling like I'm itching out of my skin. Yeah. But when we are just focused on mental health, which I'm not saying is not important, it's 50% important, 50% of the substance use, assuming we're talking about an individual that has both. We're not going to be able to see if that medication is working if we're continuing to use. Yeah. And if we stop using and we're not open to some type of medication or mental health treatment, then this isn't going to last either.
Yes.
They have to coincide. They don't always have to coincide at the same exact time on day one.
Yes.
Everybody's so different. We leave those to smarter people, right? People with letters behind their names and have studied a very long time in order to determine that. But what I can tell you from my own personal experience and speaking to multiple families, both need to be in the picture at some point. And I'm not here to tell you when, but I am here to say that if you're just going to focus on one, and I'm just going to focus on my mental health, Mike, but I'm going to keep drinking, I'm going to keep doing this or that, good luck.
Yeah.
You'll never those things are counteracting that.
Hmm.
They're not just canceling it out, they're making it worse.
Yeah. I think one of the things we're encountering a lot, or I've been encountering a lot lately, is this individual's in psychosis. It is a mental health problem,
Mm-hmm.
but they are using THC heavily,
Mm-hmm.
which is we know now is causing psychosis in individuals,
Mm-hmm.
right? Um, but they're undermining the THC
Mm-hmm.
because it's legal and
It's just weed.
it's just weed, and it isn't just weed like that anymore.
No.
And it is calling these, and the individuals that are having issues with the psychosis, increased psychosis from THC use, probably already have some underlying mental health issues and concerns.
Mm-hmm.
It doesn't mean that they can still keep using that and treat this psychosis effectively. If we can't be 100% sure when they're still heavily using THC that it isn't the cause of the psychosis,
Mm-hmm.
right? And we keep having the same kind of conversation. And I guess that's where this all starts with, right? Is the chicken or the egg idea. It
Right.
doesn't, we can't do both of those successfully
Right.
unless we're doing both of them successfully. You can't just pick one and be like, that's how it's going to go.
Right.
Right.
Well, and if an individual came to us and said, "Hey, I'm mental health primary.
Mm-hmm.
Yeah, I mean, I smoke weed. I drink socially, and sometimes I drink too much.
Yeah.
But marijuana is pretty heavily in my life on a consistent basis. Why are you telling me that I have to stop smoking weed? I just need to focus in on my mental health." I mean, my answer to that would be we have to be sober and work on the mental health to find that flat line, that baseline, I should say,
Yes.
and normality. And the only way, this is just my personal opinion, the only way someone's able to figure out if they're normal or not is you have to get well first. And if you want to take that leap to see if you're normal or not, then go do some more research and figure.
And by normal, you mean non-substance use disorder.
Sober.
Yeah. You don't have
Taking
substance use disorder.
That's right.
Yeah.
I don't have it. It's
Yeah.
just mental health. It's
Yeah.
go get healthy and then make your decision from there.
Yeah.
I mean, there's no way to figure that out if you're not willing to stop for a bit. And if you don't have an issue, I don't know why it's such an issue to stop.
I know. Absolutely. I remember years ago having a conversation with a guy who was in a treatment program, and he was going, "Mike, I don't think I'm an alcoholic, so I need to go drink to prove it."
Mm-hmm.
And it was just the logic around it all. I go, "Hey, but
Mm-hmm.
if alcohol isn't a problem for you, you're in an environment where you're not allowed to go do that. There will be consequences for doing that. Like
Right.
you won't have a place to stay,
Sure.
right? And somebody that didn't have an alcohol problem would have no problem saying, okay, well, I'm not going to drink. I can't drink here, so therefore I'm not going to drink because it's not an issue for me." And his thing was, "No, but I have to drink because I have to prove it." And I'm like,
Yep.
well, right there, you kind of saying it's already an issue.
Yeah.
You know?
It's alcoholism.
But well, there are a lot of things that from where we were 10 years ago in this industry in mental health and substance use, or 15 years ago, of course, they give me a lot of hope for today and where things are. Not only do I feel like, for the most part, as professionals, people are getting better at identifying or understanding, right? I think there's still, of course, plenty of barriers in the way and
Yeah.
issues there. We're talking about, oh, we only treat this, or we're only going to treat that. But as a society in whole, embracing mental health concerns, embracing substance use issues, and people are being more advocates for it and for themselves in it
Right.
than ever.
Sure.
And some of that's good, some of that's bad. I think a lot of people are diagnosing themselves, which is scary.
Yeah.
You know, I wouldn't recommend that. Definitely
Right.
go get an assessment, meet with the doctor, meet with your therapist, figure it out, and utilize professionals to do that. But just that people are more open to it. People are talking about it more than ever. One of the things that we've seen is a steady rise in eating disorders among males. Initially, when I started to see this trend, I thought, okay, is this something that is increasing. You know, like, okay, is this just starting to increase? And what I believe is actually happening is just that males are now feeling more comfortable talking about it.
Sure.
That it's always been prevalent, just men haven't discussed that.
Or maybe even we're aware that that may be a problem.
Yeah, but now men are discussing it more.
Yeah.
No, it may be on the rise in general. It may
Yeah.
be on the rise. You know, why wouldn't it be? But that gives me a lot of hope.
Yeah.
Right. Where something like discussing that in years past would be so shameful.
Yeah.
You know, people are, talking about their trauma
Mhm.
more. People are discussing that.
I think the awareness around that there's mental health involved is a huge victory
Yes.
for humans in general.
Uh-huh.
I don't want to just swing too far over though, where well, we
Yes.
don't have to look at this substance abuse thing because it's just mental health.
Yes.
That's all. I think that's all
Yeah.
we're saying. It's like let's
Yeah.
not go. Look, it used to be. Well, I say used to be. In my experience, was you've got a maturity problem. You need to be disciplined. You need to get your head out of your know what.
It's a character issue.
Character issue.
Yeah.
That's why you're drinking.
Yeah.
Which then I was introduced to different forms of treatment to find out that I suffer from a disease called alcoholism. And there's a blueprint for me
Yes.
that I choose, that has chosen me, really, on me to not solve that, but help me work through that on a daily basis.
Yeah.
There's a rule book for me, not a suggestion book, but a rule book. And I think what we're finding now is we've gotten away from it's a discipline thing, it's a maturity thing, and now people are more on board with the idea of this is a disease. Like my son or my daughter doesn't have a choice in this. Like this is, I feel the same way with like the mental health stuff a little bit, where it's like, let's not swing too much over here. Like I'm not saying that it's not important. My story, your story says we believe that this is important, but let's not forget this other thing that's really important. And something to be said too, not everybody goes through this, and I'm not here to say like, dare drugs, say no, and weed's a gateway drug.
Actually, I wouldn't consider it to be the gateway drug anymore.
9 times out of 10, it does not stop with marijuana.
Yes.
Just as recent as a couple weeks ago, we had a family that you and I were working with for almost a year, a little bit more, on and off.
Yeah.
Kid's not smoking weed anymore. Not just smoking weed.
Mm-hmm.
Been to 20 different treatment centers, 30 days go home, 90 days go home, whatever have you. He's not doing just marijuana now.
Yeah.
And we're not talking about a 37-year-old. We're talking about an individual that we came in contact with as an adolescent and is now a very, very young man, adult. And he's moved on to bigger and better things when it comes to the substance abuse. And I'm not saying that that's the case for everybody, but in my story, each of these substances stopped working and stopped serving its purpose, and I needed to level up and go find something that was a bit stronger, a little bit heavier, and all to battle the underlying mental health stuff that I had going on, without a doubt. So yeah, I think we've done a good job as far as like explaining that we do believe this is important. It's just that let's not be so extreme where it's like, well, we don't have to look. It's just weed.
Yeah.
We're in Colorado. It's just weed. It's legal here. It's no big deal. It's like, well, alcohol's legal too, and there's plenty of people at the Texas Rangers game that could use help.
Yes. Yeah. Well, and I believe that alcohol is the gateway drug.
100%. It was for me.
Yeah. Alcohol is
I started with it.
That's where it begins.
Yeah.
It's just never been labeled that way because it's socially acceptable.
It's legal.
It's legal.
You can go buy it, just not during certain times.
Exactly.
Thank God.
Yeah. Well, Grant, thanks for your time.
Cool.
And thanks for sticking around for another episode of Pretend I Don't Know Anything. And we'll see you soon. Thank you.